Welcome to Chapter 1 of Social Work 225, Community Health Systems. This is our first lecture over Chapter 1. I wanted to just kind of introduce this process. I will make one of these videos for each chapter, and I try to make them shorter than it would be if I was lecturing in class, because typically when I lecture in class it's about 50 minutes and maybe even twice a week, and so I try to keep this around 30 or 40 minutes. And because it's video, I have a little bit more freedom to do things like put backgrounds or cut in other clips or things like that. And I try to do that when I think it's going to enhance the understanding of students, or when it's going to make the information more interesting, or just kind of reveal different things. However, I am limited by my computer hardware, and I'm also limited by my own technical skills, which are not, at Hollywood level. But I do try to take chances, and I try to make, I try new things. And so I normally don't get that much feedback from students. So if you wanted to say, hey, this helped, or that didn't really help, or if you could do this a little bit differently, that actually would really help me in the future. So as long as it's specific and you're not just saying, hey, the video sucked, will probably be well received by me. So, well, let's talk about Chapter 1, shall we? The good news about the health of the United States is that we are much healthier than we used to be. If you look at things like life expectancy, infant mortality rate, our ability to fight infections, and you compare them to where we were 100 years ago, 300 years ago, we are really doing much better than we were. We're living longer than we ever have. A child's chances of living to be 1 year old are much higher than they were in the past. And so all these are positive things. Now, because we're not dying of the things that I just mentioned, there has been created sort of a vacuum where other newer things that in the past weren't as big of a deal have begun to crop up. Those things are oftentimes related to lifestyle choices. Those are things like cancer, heart disease, and then because we've been using a lot of antibiotics to cure infections, things like that, which has done a great job of doing that, but it's created sort of like these super bugs or super organisms that are beginning to become more and more resistant to the tools that we have. So, what is health? Let's talk about that. The World Health Organization defines health as not just the absence of disease. Are you healthy? Are you not? Well, I don't have any sickness or disease, so therefore I must be healthy. They say it's actually more than that. It includes other things like our mental well-being. How are our thoughts? How are we socially? And then, of course, our physical body. So health is multi-dimensional, which means that we could be healthy in our body but potentially not healthy in our mind, or healthy in our mind but not healthy socially. In terms of what determines our health, our book says that it's really 5 things that determine whether we are healthy or not. And we typically think about 2 things. Behavioral choices, like I choose to go to bed at a certain time, I choose to eat broccoli rather than French fries, and then our genetics. This is what I received from my parents, my biological parents. But that's only 2/5 of the pie. The medical care that is available to you makes a big difference as well, as does your social circumstances. What kind of a job do you have? What are people around you doing? Because that makes a difference as well. And then the last one is the environmental conditions. What is the air quality in your neighborhood? How safe are the roads? How safe is the water? We oftentimes emphasize personal health decisions, and I think we should, because that's the one that we probably have the most ability to change. I'm going to have a hard time changing the air quality in my neighborhood unless I move, but I will have a lot more control over when I go to sleep or whether I choose to drink alcohol or not. Community health, kind of as a discipline, aims at helping the health of the population. Right? It helps with things like protecting food and protecting the water. Or on the other side, if they choose to walk away from community health, they're going to do things like deregulate. So tell companies that we're actually not going to watch over what you do in terms of your food safety, in terms of how many chemicals you dump into the water that later on somebody drinks. So community health is sort of on a scale of you could pay a lot of attention to it and hopefully people will be healthier because you do, or you could pay less attention to it and likely what is going to happen is that people's health are going to suffer. Generally, that is the people on the kind of the fringes of power. So that's children, that's elderly, that's poor people, that's minorities. Other things that community health can do in terms of not just like protecting food and water, but also maintaining accurate records, of who is living in the community, right? Because it's hard to recognize whether a problem exists or not unless you're keeping track, you're paying attention to how many infants are dying or where in the city these issues are cropping up. But moving on to talk about factors that affect the health of a community. So when you think about one community versus another, why is one, say, healthier than another? A couple things here. Physical factors, meaning let's talk about things like geography. Where is the community located? Are they in the southern part, let's say, of the United States, in Texas or Florida? Because the geography, the land, the soil conditions, the humidity level, the weather is different there than it is in, say, Maine. Okay. The amount of toxins that are in the water is very different. The amount of trees, the amount of green space, those things impact air quality, they impact the temperature in that environment. The size of the community impacts it as well, and in a couple of different ways. The more people that are in a community, the more likely they are going to have doctors that are specialists. If you're in our area, which is rather rural, there's a lack or there's less specialists. So for instance, like a child psychiatrist, there aren't that many of them. Whereas if you were to go to St. Louis, there's a significant number more doctors and more specialists that are in those areas. But on the other hand, if you look at crowded areas, there are more sick people in those crowded areas, and because people are closer together in crowded areas, the ability for infectious disease to jump from one person to the next is higher. If you look at 2020 and the rates of transmission of COVID-19 in New York City, it was very, very high. Why? Because you have so many people packed into a relatively small space. Whereas if you compare that to, say, North Dakota, where people are much more spread out, the ability from the virus to jump from one to the next is very reduced. Other things that matter are things like industrial development. If you have more industry, that industry is likely going to produce more pollution, but on the other hand, it's also likely to produce more jobs, and those jobs may come with health insurance, and the health insurance allows people to go visit the doctor and invest in their health. And so it's a double-edged sword, you might say. Social and cultural factors of a community also make a difference. The beliefs of that community. Do they believe that doctors are out to get them, or do they believe that doctors are trustworthy and they have their best interests at heart? Do they believe that bike trails are worth investing in? Do they believe that vegetables are worth paying for? Or do they believe that actually cheaper food is better so we can spend it on other things, right? All these things make a difference as well. The economy of an environment, when you have a bigger economy, you have more tax dollars, and you can spend those on healthcare, on building clinics, on charity work. Politics makes a difference. When politicians want to invest in people's health, then it tends to have a more positive impact. When politicians say, well, we don't think that's our place to say what people should be doing with their time or what people should be eating, that tends to have a more negative. I should not go any further before I get myself in trouble here. Social norms. What is acceptable in the community? You know, in some communities, people that smoke are kind of looked down upon as, what are you doing, poisoning yourself? In other communities, it's much more acceptable. When in some communities, riding your bike down the road is very acceptable and it's smiled upon. In other places, people honk because you're endangering yourself or you're in the way of other traffic, right? So, and then individual behavior. Now, individual behavior, it makes a difference in community health because what one individual does makes a difference. So, for instance, if one individual and then another individual and then another individual, if they all decide that they want, I don't know, fresh wheatgrass juice, right? Then there's more likely that the grocery store is going to begin serving that or making that available for their customers, right? And so there's suddenly this new juice bar that shows up in the local grocery store, and other people are maybe thinking like, well, what's that thing, that weird thing over there, and why are people drinking grass, and isn't that really gross? And they're like, well, let's try it out. And so people try it, and they're like, wow, that does taste gross, but they notice that 5 minutes later they're feeling really good. And so people's individual choices to drink wheatgrass juice or to exercise makes a difference because the environment shifts based upon what individuals do. If you want to have a marathon, then oftentimes the environment shifts to accommodate for that, and that draws other people into it. And then community organizing is the last thing here. Community organizing is what the community prioritizes as worthy of focusing on. You only have a certain amount of money, you only have a certain amount of time, and so how are you going to spend those resources? And some communities will invest it in one way, and some communities will invest it in another. Let's talk about the history of public health. We're going to start in Europe. In the 1700s in Europe, this is the beginning of the industrial era. It started in England and kind of spread to other places in Europe and then also in the United States, but that was more in the 1800s when we became more industrialized. But in the 1700s, they're beginning industrial growth, which means that people are moving from the farms into the cities, and they're there working at factories. And the cities were unprepared for an influx of people, and so the living conditions are really bad. You have very unsafe factories, you have unsafe apartment buildings that are overcrowded, that don't have the ability to keep the floors, the homes warm. You don't have safe water for people to drink. There's not enough sewage infrastructure, and people are working long hours, and they're sleeping in unsafe conditions, and they're drinking dirty water. And so you can imagine that the impact of this is bad, and people's lives are not very long, and they're cold, and there's lots. Fortunately, that led to regulations and laws being passed that say, hey, we need to invest in this infrastructure, we need to invest in laws that say that you can't have this many people in a very small space, and you have to maintain safe water and heating and things of that nature. Skip to the no, sorry, we're still in the 1700s. On a positive note, the first vaccines are created. Now, vaccines, a form of vaccine called Variolation has actually been around probably for thousands of years. If you go back to India, they did some sort of form of vaccination back then where they would take a little bit of the pus or the scab of somebody who had a sickness and they would apply it to a healthy person. And what they found was that sort of inoculated them. And now it was primitive, we would say today, and some people who were, given this inoculation ended up contracting it right after they were given it, and some of them ended up dying from it. But it was sort of the beginnings of this. Dr. Edward Jenner is given credit for kind of scientifically demonstrating that vaccinations are effective against smallpox. Smallpox during this time was a very deadly disease. It was killing 25% of everybody who was infected by it. And I guess you could say he also cleaned up the process where he was, taking an injured or a dead form of smallpox and giving it to people as opposed to what they were maybe doing before, which was actually taking some of the live sickness of the disease and giving it to the other person. So, in addition to smallpox, there's also epidemics of cholera and yellow fever, and government agencies begin to say, maybe we can try to focus on these and try to make things better for people. So, skipping forward now into the 1800s, moving to the United States. Again, the United States at this time is beginning to ramp up its industrial production. People are moving from the farms. The reason why they moved from the farms is because we had gotten much better at growing lots of food, lots of calories, and so you needed less farmers because one farmer could now feed more than just himself and his family and a couple of other people. And so there's excess labor, and that's going to the factories, which the factories were built near cities, and then the people are moving to those places to work, and so the cities really expand pretty dramatically during this time. And so more nutrition is very good for the population. In fact, even though we don't think about it today, we think about extra calories as primarily being a bad thing. But if you are growing up in the 1700s and it's wintertime, you're worried about not having enough calories. So excess food is a positive. It increases life expectancy. It increases health. During the first half of the 1800s in the United States, there's not very much government action that is taken. However, in England, jumping back over to Europe, John Snow discovers that disease is not a miasma that kind of floats through the air that infects people. It's actually something that is microscopic or is unseen anyway, and that it travels through, in this case, the water system. What happens here is that there's a cholera outbreak in London, and John Snow does some research and discovers, or he believes, that the outbreak came from a single water pump which had the disease in the water, and everyone who was getting sick was drinking from this one water pump. It took a while to convince the authorities, but eventually they let them shut it off to close it, and then once that happened, then people stopped being sick. So this was a big step forward in people realizing that this is how disease is transmitted. In the 1800s in Massachusetts, they begin to make recommendations about how public health could take specific actions, such as collecting vital statistics on people, educating people about health, reducing smoking. And so there's sort of this plan put into place, or at least an idea about, hey, if we want to focus on public health, this is a way of doing it. So this begins the modern age of health in the United States. In the 1900s, the 20th century, the leading causes of death in the United States are influenza, pneumonia, tuberculosis, and GI infections. Large cities in the northeastern part of the United States, this would include cities like Boston, Philadelphia, New York City, they're receiving a lot of immigrants from, in the early part of the 20th century from Eastern and Southern Europe. The Great Depression and World War II. A couple of results during this time period. Again, this is during the early part of the 1900s. The Great Depression brings upon kind of this awakening of understanding that our health and our welfare is not merely because of our own choices. Still to this day, I think you'll find a lot of people who will say, like, well, if you want to be healthy, then you can do this and this, and if you don't do these things, then when you're unhealthy, like, it's your fault, or if you want to be rich, then you need to do these sorts of things. During the Great Depression, a third of Americans lose their jobs, and it is difficult to make that argument that 30% of Americans are unemployed because they are bad workers, they're lazy, they're uneducated, things like that. And so as a result, people begin to say, actually, there are things that happen that aren't always in our control. And so people begin looking to the government, ultimately electing Teddy Roosevelt, who promises to reform the way government interacts with its people by creating lots of jobs, by spending lots of money, by expanding the size of government, and he does that. And then World War II happens, and economic activity really ramps up, so that puts a lot of the people who were out of work during the Great Depression to work, but it also reduces the amount of money and resources that are available to local health departments, as you might imagine. During the war, there are certain antibiotics that are developed, like penicillin, which are very helpful to soldiers who are wounded on the battlefield. And then after the war is over, those technologies are then more given to the civilian population, and this is a really big step forward. A lot of lives have been saved by antibiotics like penicillin. It is after World War II when I have this theory that really the world changes, especially in the United States. It really changes pretty dramatically after World War II. We, for instance, when we're in Europe fighting the Germans, one way or another, we see their Autobahn, which is their highway system, and when we come back after the war, we build our own version of that. And so the interstate highway is really expanded after this time, and the interstate highway really creates a way for suburbs to be built. Today, most people in the United States actually live in suburbs, and a lot of money is being spent. It's a time of prosperity. The CDC is created. We increase our research on vaccines. We target heart disease, as this is the #1 killer at this time. It actually still is in the United States, but we've certainly made a lot of progress in understanding the roles of cholesterol and high blood pressure and fat and salt, and that has made us much healthier, and people's lives have increased in length and quality. In 1965, Medicare and Medicaid are created. Medicare is for the elderly, and Medicaid is for generally the poor, speaking broadly here. And these are gigantic programs, and they really help a lot of people, especially the poor and the elderly, have access to health care. But, of course, these are expensive programs, and so it's during this time, the 1960s, when the cost of healthcare really begins to get much larger, and that has not stopped since then. I might also add that one of the reasons why healthcare is really expensive is because we have so much of it, meaning we have so many technologies, so many pills, so many procedures that we didn't have in the past, and so those cost lots of money because we have them to use. So, health promotion is suddenly focused on, where scientists begin to understand that one of the biggest determinants of health, after we've eliminated infectious disease, that's not much of a scary, not very many people today are dying of infectious disease, that the thing after that is the things that we have control over: whether we exercise, whether we eat our vegetables, whether we go to sleep, at a reasonable hour, whether we smoke, whether we eat, fatty meats that create heart disease, and all these things that are actually in our control. So there begins to be this a focus on having people make healthier choices. And of course the food industry gets involved in this, and they begin marketing foods as being heart healthy or fat free, low sugar, things like that. And a lot of that is, I think, just marketing, and I don't know that it's a lot of health focused, but they're just selling to us what they think that we want. And some of that is has kind of led us astray, at least in my own opinion. For instance, we've reduced the fat content of food, but we've substituted it for sugar, and I think that probably was a bad trade-off. Moving on. In 2000s, we passed the Affordable Care Act, which is intended to give the vast majority of Americans, make sure that they have health insurance. The Affordable Care Act, not a beloved law by most Americans, but the intention of it is to do twofold. It is to bring down the costs of health care. That's why it's called the Affordable Care Act. And it's to make sure that health care is more broadly spread. There are about 40 million Americans who do not have health insurance when the Affordable Care Act is passed, and since then I think it's actually reduced by half in terms of the number of Americans that are still not insured, but that has been kind of tweaked and changed, the law, and so that number actually has begun to climb in these past few years. Unfortunately, healthcare is still really expensive. In 2020, healthcare was $4.6 trillion. That's one out of every $5 that exchange hands in our economy is related to healthcare. That is about $11,000 per American or per person in the United States, and that's very expensive. In fact, that's the most expensive. We spend more money on healthcare per person in the United States than any other country in the world. In terms of communicable diseases, these are diseases that can be passed from one to another. There's a lot less people dying of this, even considering COVID. Understanding of these diseases and how they pass and how they kill us has really increased, and so that's really reduced the number of people that are dying from them. HIV, for instance, is still killing tens of thousands of people each year, but even that number has gone down. On the other hand, communicable diseases are the main reason why people are missing work and school. It's just that they're not as deadly as they used to be. Drugs and alcohol are still deadly and killing thousands of people per year. Today, the drug that's killing lots of people are opioids. Painkillers is the form that it's usually taking, where people are overdosing on these and people's bodies are shutting down because of this. There's other issues in the United States with health disparities, where you see certain segments of the population are very healthy and they're living a lot longer, and their quality of life is much higher in terms of their level of health, and then other segments are dying earlier. They're being forced into retirement due to disability. Their access to health care is a lot less, and these disparities are often along racial lines, ethnicity lines, location lines, and class lines. So people who are more middle class or upper class have a lot more access to those people than those people who are in the working class and lower class. So disasters seems like it's increasingly becoming a health issue in the United States. If you look at hurricanes, you look at wildfires. In 2020, New York City, which is on the far east coast of the United States, their air quality was impacted by California wildfires, which is on the extreme west coast. I almost said left coast. On the extreme west coast. And so we have smoke from wildfires that's traveling thousands of miles and impacting the air quality of major cities. In addition to floods and hurricanes and other things that would, disrupt the supply lines for things like water and food to areas, and all the environmental scientists say that this sort of thing is going to only increase in the United States and around the world, unfortunately. All right, let's take a look at the different health organizations that are in the world, starting with the largest, the World Health Organization. They're headquartered in Switzerland, and their purpose is to increase the health of all people and having all people be as healthy as they possibly can. They take a leadership role in the world and try to direct research dollars to go to the places where it is most needed, and they set norms for how to do various things, like how to test for COVID-19. They give technical support, they create ethical policies for how health should be distributed, and then they do a lot of monitoring of statistics, how many people are sick in these areas and how many people are recovering due to these things. It is paid for by all member countries according to their ability. In the United States, our primary health agency is the Department of Health and Human Services. If you look on page 20, it breaks down that department and the different branches of that. In addition to that department, there's the Center for Disease Control, which is headquartered in Atlanta. There's the Federal Food and Drug Administration, and then there's the Indian Health Services. Going down another level from that, you have state agencies, which obviously are responsible for the 50 states that they are located in, and their agenda is to promote and protect and maintain the health and welfare of its state's citizens. If you go down even farther and go into the local or the city level, there are about 2,000 to 3,000 local health departments, and these local health departments are taking their initiative from, or their directions from the state and from the federal government who are over them, and they're doing the hands-on direct health services to the people that are in their catchment area. And these are the ones that have the power to close restaurants. So, if the health inspector comes in and finds that they are not, washing their cutting boards after cutting chicken and just infractions like this, that they have that power to close those places. In addition to government agencies, there are quasi-government agencies, which means that they are independently operated, but then they also do some governmental tasks. An example would be Red Cross. Red Cross is partially kind of government. They do some government tasks, but then they're independently operated. There are also non-government health organizations, and these are private, and in a sense they can kind of do, they can follow the agenda that they think is most pressing. An example would be a March of Dimes, the Race for the Cure, the American Heart Association, and there are lots of other, Doctors Without Borders. It would be an example of a non-governmental health organization. So that is chapter 1.